Well, hey, we are back for part 2 of the
Dose.
Gaslit Truth podcast, and we're talking about
Lines.
what is missing in addiction care now that we went through. So if you haven't listened to part 1, it's the episode right before this, and
Yeah.
we go through all the diagnostic criteria and things of that nature.
Yep.
And now we're talking about what is missing in addiction treatment. And frankly, it's the same thing that's missing in mental health care. But I think it's missing even on a deeper level with addiction treatment, and I'll tell you why I believe that. One of the biggest reasons why I believe that is because often people who come in with I'm going to be using the word addiction, even though the DSM it's a substance use disorder. Okay, just so you guys
Yep.
know. So that word is going to be interchangeable in this episode, even though we don't like it and people think it's defamatory, blah, blah, blah. It is what it is. It's just a descriptor for today. So anyway, a lot of people who come in with addiction type things, alcohol, drugs, well, even psychiatric medication for that matter,
Yep.
are largely nutrient deficient. They're not paying attention to what they're eating. I don't want to say this particularly true, but I see this often a lot with alcohol and women in particular because they're drinking their calories through
Yes.
their alcohol, and so
Yep.
then they don't eat. All right. So if
Correct.
you don't eat, what happens is your brain is not going to be functioning and you're going to lose muscle mass. And,
Mhm.
it's very interesting. And I'm going to be a little stereotypical for a hot second here. So when we're down in Florida here, I can point out with very big accuracy, particularly women, older women down here who probably have alcohol issues because they have spindly little legs, they've lost all their muscle mass, and they have a larger middle. Okay, so you can spock it out: spindly arms and legs, larger middle. And I'm like, I see that in these women, and I'm like,
It's very nutrient deficient.
exactly. And so when you think about kids with even kids with rickets and things like that, what do they look like? They have spindly legs and they have a
Yep.
big middle, right? So
Yes.
nutrient deficiencies are huge in these
Yes.
populations. And I was saying particularly in women, because they will drink their calories
Yes.
rather than eating nutritious food for calories.
Yes.
So,
Yes.
you
And
know,
so that's something we're
that's
gonna talk.
diet culture
It is.
mixed in the whole thing,
It
you
is.
know.
It is. And when you are deprived of nutrients, when that nutrient is very deficient, which I think this is coming from a few different spaces, which is why we talk about it. So nutrient deficiency can be coming from, you can deplete the body of nutrients. For
Mhm.
example, folic acid. Folic
Mhm.
acid is one of the nutrients that is greatly depleted from alcohol, but also from SSRIs.
There you go.
Okay. Okay. So we're gonna try to make these pairings as we're talking about this today, because what you're gonna find, what Terry and I are gonna be talking about throughout today, is this idea that addiction and treating addiction can actually be very neurochemical. Okay.
Mhm.
And that if we really look at this buzzword, right? If you listen to our last episode, we talk about this word dependence. Well, Jen, you can't be addicted to Lexapro. You're just dependent on it, right? We're going to
Mhm.
say this blanket statement today, and this is going to sound asinine and crazy to some of you who I'm going to say have been harmed by the addiction treatment protocols you've been
Mhm.
given over time, if you have been. Physical dependence, psychological dependence.
Mhm.
Which one am I missing? Like the physiological piece, physical. What am I missing? The other one. There's one more. There's three. There's the big three. I forgot. I'm like, here I am making a bold
Withdrawal,
statement.
withdrawal,
They
withdrawal.
are all, they are all, we are going to say this today. They're all neurochemical. We
Yeah.
are going to say that like all forms of dependence, whether it's psychological, physical, they are all neurochemical.
As evidenced by Big Pharma trying to crack the code all the time
Yes.
by introducing more neurochemical responses to people who already have a neurochemical imbalance.
Imbalance.
Now, what we know is the chemical imbalance theory to begin with
Yep.
addiction and, mental health problems doesn't really exist. But what does exist is a chemical imbalance once you've already started. So even if you are a heavy drinker and you wouldn't qualify as substance use disordered, right?
Yeah.
You are messing with your neurochemistry in a
Yes.
big way. Okay.
Yes.
So if you are a daily user of psychiatric medication, you have created a
Yes.
chemical
Which
imbalance.
which
Hmm.
really is the bitch in all of this, right?
It
Because
is.
there are multiple, like, if we just go back to the root, like we're talking about
Mhm,
root cause, if we go all the way back to the beginning, which is really truly, for those of you who have done addiction treatment, which is really
mhm,
where it should start. Okay.
mhm,
That's where this timeline matters of, all right, let's go back to the beginning. What factors would have messed neurochemically with you from the start? Because for most people, at least in like my experience, right, I met so many few people that could say to me, Jen, there is no pharmaceutical interventions interweaved throughout any of my history. Okay. Like, I'm an alcoholic or I really struggle with heroin, but I've never touched anything else. Very few people can say to me, like, I grew up in an environment full of green trees. I don't have any issues, right? Like with any
no,
asbestos that I was ever exposed to in my life. I grew up, right? Like, because those all matter. These are the things that are all messing neurochemically with you. I have yet to meet somebody who is like, here's my diet, and I didn't fall under that standard American diet at all. Like when I was younger,
mhm,
growing up as an adult, I kept things clean, super nutritious, right? Whole foods, grains, like that all is part of the picture. So
it
then
is.
here we, so that
Mhm,
all matters, right? Like if we don't look at addiction from an integrative standpoint and looking at all those factors, right? Like,
well,
yes,
and
I
just
was
even
never
the,
exposed to mold. I was never exposed to
mhm,
mold, Jen, ever, right?
right, that
But
I know of, you got I
r
mean,
correct,
there's
so it's like
always that, mhm,
we won't always know the answer to all of it, but in traditional addiction treatment, we are not going back and individualizing this timeline to see, here in the last 32 years, this is what has all contributed to your addiction.
nobody I don't even think that that was a part of the questioning, like,
Oh, no, I never, that was never, oh my
what
god.
kind of food did you eat as a child? What did you
Oh,
eat
no,
as a teen?
that doesn't
Any of
exist.
that stuff wasn't, and I don't want to jump over the fact that a lot of people with addictions have also struggled with trauma,
Trauma,
right? So we're not but that is still part of your history,
correct.
right?
Yep.
And what does trauma mean to you as a person? It
Yes.
doesn't have to be a giant thing.
Yes.
I'll revert back to my husband and his story, like, and he never even thought about this and nobody ever addressed it. And of course, this was 30 years ago when he entered treatment, not
Yeah.
treat when he entered recovery, when he
Yes.
went to treatment. n- The treatment that he went to was not 30-day treatment or anything like that. Anyway,
Yeah.
when he saw a therapist, counselor, whatever.
Yeah.
Anyway, nobody asked him about his trauma. And the thing is that he had two big traumas. At 15, his dad passed away. And when he entered recovery and his marriage kind of blew up the first time, they had lost a son. So he had two major traumas in his
Yes.
life that nobody at that time even looked into, you
Yeah.
know.
Mhm.
It was all about the addiction, right? So when you go to a substance abuse counselor who is a 2-year associate degree person, they're not equipped to dig into your trauma. What they're going to be doing is looking at either you're using something or you're not, and here's how I'm gonna help you not use
Yep,
it,
yes,
right?
yes.
Um,
You gotta go, we go, like, you gotta go back. Like,
right, which is so
we've
funny.
had so many
I
guests
well
on this episode say the show say that too, right? Like, we just had Dr.
Mhm,
Kendra Campbell who was on, right? And she said
yep,
that same exact thing. Like, you
you gotta
find
go
where the
back.
harm was, find the harm, right? And we are not trying to pathologize everything here, so we are not, but at the same time, for many people, you go back and you find the harm, you find the
Yeah,
trauma.
so there's 2, like, not just 2, there's more facets to this than that, but
Yeah.
there's finding the trauma or the harm that happened, the pain,
Yep.
finding your pain, and then there's also correcting the neurochemical imbalances that are now
That's just it.
created. Yes.
That's what I was missing, right? The word chemical. So when I was just trying to
Oh,
come up with like this is what I was trying to
neurochemical.
come up with. There's no difference between physical and chemical or even psychological dependence.
There you go.
They're all neurochemical. That one
Yeah.
word, words I heard today. So right, right. Like so this is this crazy ass idea that we're proposing. So when we're talking about nutrients, right? Like when we're talking about what's beneficial nutrient wise, we talk about this for especially someone who struggled with addiction, right? From a brain health perspective, if we
Mhm.
can take and look at all of these things. So right when anybody comes to Terry and I to do some neuro health work, by the way, and we have several clients, right, that are
Mhm.
going through that are either in addiction, okay, here's that buzzword again, but or are in recovery, right? We have several
Mhm.
ones, right? It's this
Yep.
idea that nutrients are essential to your brain health, right? So healthy fats are essential. Protein,
Mm.
healthy proteins are essential. Healthy calories from like
I'm
good
gonna go
complex
on and
carbs.
say non-negotiable.
Yeah, it is.
Like,
Yeah,
not
like
just essential,
yes.
these are
Yes.
non-negotiable
Like you
items.
yes, I would yes, I would
Mhm.
say yes, proteins are your non-negotiable, the healthy fat, yeah, you're right. Everything that we're gonna talk about with nutrient-wise is healthy calories from like complex carbs, like your whole
Mhm.
grains, right? Your brown rices, right? Your vegetables and potatoes,
Mhm.
vitamins, okay, and mineral-rich
Non-negotiable.
foods, non-negotiable. So if you're talking to me about this and you're not willing to talk about like nuts and
Mhm.
dairy and leafy greens, now some people can't have some of these things, right? These are all very blanketed statements, you guys, but like fruits, veggies, right? Water, how much water,
Mhm.
cutting out sugars, caffeines, like these are non-negotiable
Well,
from a
so
brain
I
health
want
standpoint.
right, so sugar and we're talking about addictions and mental health, and often they roll together. Um, when we go back to addiction treatment centers, and I don't know how many addiction treatment centers you know have visited or seen on the outside because Jen did it. Well, I mean, I did drug and alcohol on the inside as well.
Yeah, all of
But
my
on the
treatment
outside,
was not on
yes.
the all of my treatment,
Okay.
has been in state facilities.
Right.
So I
Okay.
can say
So
that for me.
on the outside, nutrition becomes the negotiated factor in a treatment center because of budget. So the first thing to go is food. All right. So food is expensive. High quality food is expensive. So you'll see, like, I've visited many treatment centers. The majority don't care about food. Okay. They don't care about food at all. As a matter of fact, they will have simple carbs laid out for people to snack on. They will have cookies and all for people to snack on all
Cookies and
day long.
coffee, donuts and
Mhm.
coffee.
All day long
Yeah,
because it's cheap. That's
yeah,
that stuff is cheap.
yeah.
And so
Well,
it's always
yeah,
alarming to me when I see these. There's only been a couple, and I've only toured a handful of places, so I cannot make a, sweeping discovery of the entire, United States. So if you have a treatment center or know of one that has a strong, strong nutrition program, did I lose you?
no, you're listening.
Okay, you're all right. No,
I'm
you're
I'm
graining, you're
compelled.
graining. If you've been in or know someone or run a center that has a strong nutrition program, drop it in the comments because we would like
Yes.
to
Oh,
we would like to know,
yes,
because
we
these
wanna
are
know.
we wanna know. So, every time I visited a, treatment center, the first question I ask is, "Can you tell me about your nutrition program?" That's what I say, because that's important to me for your long-term recovery, okay?
Yes.
And the second question that I ask is, do you teach your clients how to eat like this when they get home? Do you teach that? Unequivocally, 99% of the time, the answer is no, we don't. Okay? There was one program that I went to that did. Okay?
Yeah.
And that was the very first program that I went to, and they're now no longer. It was in Stewart, Florida. And so this was the same treatment center, setup, whatever center. They had people in a building that they stayed long term, and then they would bus them in and out into their location, whatever. But they did amino acid therapy there. And so this was the first time that I had ever been introduced to amino acid therapy in practice. I had already been researching the shit out of it. This was
Yeah.
years ago. And I was so intrigued and involved with, wait, this is more than just dopamine? Not to mention this is more than just let's talk about dopamine, but God forbid, we're not going to tell anybody what to do about dopamine.
Yep.
We're just tell you that your
Yeah.
dopamine is fucked and that's just the way it's going to be.
Yep.
And, there's no way of telling you what to do about it. This was the
Mhm.
first place that I had known of that was doing this in a profound way. They were doing it in two ways. They were doing it in IV therapy, and they were also doing it with supplement bottles,
Supplements.
right? Yeah.
Yeah.
So I remember she showed me they had a big cabinet and it was just filled with supplement bottles, and everybody had their individualized plan, and they would go and they would fill their little compartments, and then they'd go back and then they'd have all their programming, and they had
Yep.
yoga, and they had, all of this holistic stuff. And the one thing that they also did was they were teaching the residents, I'll call them residents, they're teaching the residents how to make nutrient dense smoothies. Okay. And
Mhm.
I asked, why smoothie? Why aren't you teaching them to cook? And she said, because smoothies are really easy to make. Like you just
Yeah.
throw the ingredients together in a blender and now you've got a nutrient dense meal, easy, that doesn't require cooking. And I was like, that is the most smart
Yeah.
thing,
It
you
teach the
know,
things that are
that
realistic for when you're not
yes,
there. Like teach
exactly.
the skill sets that are realistic, because most
Yes.
people are not going back to a nice, gorgeous, beautiful kitchen filled with
Mhm.
all the things that they need and they have all the tools, and
Right.
it's like a lot of people aren't.
They're
A
not,
lot
and
are not.
and and by the way, it takes a lot of effort to cook, and
Yeah,
time and all
it
this, I
does.
know, and so people throwing it in a blender,
Mhm.
that's easier,
Yes. Yes.
So that program really kinda tipped off my larger curiosity. I wish it still existed. I
Well,
do know that there are programs out there now more than there were before that are doing
yes.
similar
And
things.
I just wanted to say that too. That's another thing. You just talked about nutrition.
Mhm,
If anybody out there that's listening to us also has went through a form of addiction treatment, because this is what
mhm,
I'm looking for, is for somebody to come and say, I have done an addiction program that focused heavily on food, amino acids, supplementation, right?
mhm.
Along with, like then full blown types of like mindfulness, right? Like
Yeah.
I want to hear that. I want to hear full lifestyle stuff, which I do know that some exist because we have had a couple people on this program that actually do that.
Mhm.
Okay, and
Yeah,
they
I
don't
think
run big
you're
addiction treatment centers. They
right,
do
that's the
not.
key.
They do
Mhm,
not run big addiction treatment centers, right? They do a lot of individual work, with like kind of like
mhm,
you and I do. So
mhm.
we've had that. I'm looking for like a center that does this, right? Because I would love to just hear that. I would love to hear
Mhm.
that. The first line of treatment is not, hi, you need help with your thinking errors. It's no, guess what? We're
Yeah.
focusing on B vitamins and folic acid, fatty
Not to
acids,
mention, Jen, when
omega
you
3s
go
and
in
amino acids.
oh, wait, when you go into a treatment center, you are fresh off of whatever
Yeah.
substance you were using,
Yeah. Yeah.
and then they're saying, "Let's focus on your treatment errors." Now I'm gonna ask you, when you taper down a
Yeah.
milligram of your
Okay. Yeah.
Lexapro,
Because I
yeah,
am an addict, by the way.
yep.
Like
Are
I
you able to
am.
focus
I'm
on
addicted.
your thinking errors at that time?
So let me tell you what happens when I titrate down,
Mhm,
less than a milligram. That was my last titration, was less than one
mhm.
milligram on my Lexapro. Um, so I would look at an object and I'd say, "Hey, look at this fork. Isn't this a great looking fork? Is this
She's
a
holding
beautiful
up a
fork?" I'm like
pen for those
holding
of
up a
you
pen,
that are
everybody.
not on YouTube. Mhm,
Yeah, or I would start talking and I would really just be able to stay focused on something and be, like, it's really great today that we're going to start talking about what you guys were doing in school today. And there was this plant that I saw and it was at Target, and I really just wanted to get in the car and drive to Ohio, but I wasn't quite sure if the dirt that was in the mug was going to blend with the tire.
yeah. Yeah. Mhm.
Literally, trying to
Yeah,
have a conversation with my kids about school. That's what it started with. Okay.
right.
This is so the brain fog is horrific. The ability to word recall is horrific. To store information, short term recall, right in front of you.
Mhm.
Jennifer, I just told you 3 minutes ago about this. Why are you asking again? This was my husband's feedback.
Mhm.
Oh, yeah. Okay. Wait a minute. Yeah, you did. Okay.
Yeah.
Not to
Yeah.
mention all of the unaliving thoughts that happen and the akathisia and the tardive dystonia and all that. Okay. So
Mhm.
that's what happens when you are in withdrawal.
Yes. And
And
so
that lasts a while.
that happens for any withdrawal process, you know? And so you're saying, okay, person with an addiction problem, what you really need is maybe detox first for a week and then go straight into an addiction center, right, for 30 days. Um,
Yes.
what we do know is that just because you are clean and that drug has left your body
Shelf
doesn't
life.
mean that yeah, the half-life, not shelf life,
Sorry.
the
Oh,
half-life,
shit.
yeah.
Oh, sorry. It's
Done it
half life.
again. The
Dang it. See the
half-life,
words.
yeah,
It's
mhm.
not my fault.
What we know is that half-life has nothing to do with your withdrawal symptoms
Yes.
after it has already left your body,
After it
you
has left
know?
your body. Yes.
Elvis has
And
left the building. It doesn't matter.
even when he's gone, and it's tragic because he passed away on the shitter. Okay. We know this, even though it's gone. Guess what?
Gone
From
but
a
not
brain
forgotten.
health perspective, your journey is just starting, and it is
Mhm.
going to take your brain, okay,
Mhm.
months, if sometimes years,
Years.
to
Mhm.
reach a level of homeostasis by which your neurotransmitters are
Mhm.
communicating with the brain in the body in a way that's the most effective for you. So
Right.
the idea of putting somebody in a 30-day, 60-day, even 90-day treatment center, right? Which, by the way, only happens for celebrities or people that, oh, I don't have a good half a mil just sitting somewhere to shell out
Right.
so you can go somewhere for a month or two. Okay.
Mhm.
Um, your brain and body still have not reached homeostasis. And so here you are really trying to, I'm okay, I'm functioning, I'm better. It's been a month, I'm clean. Same shit that people talk about when coming off a psychiatric medication. I'm clean. It's been out of my body for a week, 2 weeks, 3 weeks, but yet that all of a sudden what happens later? Protracted withdrawal. 6 months
I'm
later, all of a
depressed.
sudden,
I'm anxious.
yes, I'm anxious, I'm
Mhm.
depressed, I'm getting these weird brain zaps that are coming like 60 days after I stop taking a medication. It is no different than alcohol,
Mhm.
heroin, cocaine. And people say this all the time. They say, I have never met an addict that after about 30 or 60 days didn't function great after they were clean. And I argue that point all the time. I'm like, do you have any idea what's actually still trying to happen in the brain? Which, by the way, many of them are still maintained on psychiatric interventions.
Right.
So you actually have
You know
yet
what I
to
think is
even get
really
there.
weird? There's so many people that I have met over the course of my career that are struggling with alcohol. Well, I'm just gonna use alcohol as the thing, 'cause that's who I mostly see.
Yeah,
Um,
same.
and they're immediately, even though they're not clean, we'll use the word clean, they're not clean of alcohol, they're put on an SSRI,
Yeah.
okay? They're put on an SSRI for but yet they're still drinking a depressant, and the depressant that they're drinking is mostly impacting their GABA receptors.
Yes.
It will impact all of your
It,
neurochemistry
yeah.
at some
Well, you
point,
got to
but
talk about that. Can you like
mhm,
either right now you take a TV timeout or when you're done with your thought, because I think
mhm,
people need to hear that part too.
okay.
Yeah.
But I wanna say if I see another doctor prescribe an SSRI for someone who is actively drinking, I'm telling you right now, it is not helping. It's not helping them on any level at all.
An SSRI or even a benzo is not helping on any level.
Okay, so a short-term benzo, if you have serious withdrawal symptoms from alcohol, a short-term benzo can be very helpful in mitigating some of those life-threatening
Okay.
responses.
I'll give you that.
Problem is
I'll give you that.
problem is that we have seen and continue to
Yeah,
see
we got it
people
happening right now.
prescribed the short-term benzodiazepine for
They won't ever
alcohol
happen.
withdrawal. They
Never
never
happen.
withdraw from alcohol, and they're still taking the fucking benzo.
Yeah,
And
okay.
nobody's questioning that at
Yep.
all. And
Well,
the doctor keeps
we do.
we do. The
We
doctor
do when
keeps
they come to us.
re-prescribing the benzodiazepine for years
Yes.
without ever asking about the alcohol, you know?
Yeah, all right. Yeah,
So
okay.
I
I'm gonna give you
feel
that.
like
All right. I can't
yes.
say such a bold statement because you are accurate. Short term, you're right. For short term use,
Mhm.
I all right.
But when it
I'll give you
turns
that one.
into long-term use,
Okay.
you know, if it's very pinpointed for a reason for withdrawal, that's a
Yes.
different story to me than you keep prescribing it,
And that
especially
that
keep prescribing
okay.
it knowing the person has not entered into recovery at
And
all.
that goes back to a statement that I have made before too, that we've had people on the show that have asked, like, when is it appropriate to take for pharmaceutical interventions to be brought
Then
into play? That is an example. Like, I talked about patients that were in a space that were severely psychotic, right? Or patients that
yeah,
were ready to unalive
short
themselves.
acting, kinda
Yes, like
chemical
that's
restraining
that
stuff,
that
yeah.
kind of stuff. And people would still argue that, right? We've had a few guests that
Mhm,
recently that would argue us even in that, and I would say, oh, great, I'm open to it, because that for me, I
mhm,
still saw a benefit from that, but it was very short term. Okay,
mhm.
and it still messes with your brain. Okay, which is why this shit works, people. By the way, like this is
Right,
why it's working. I mean, because we are
right.
altering your chemicals in your brain. And Terry, I want you to talk about a statement you just made, which I love to call "you rob Peter to pay Paul." Because when I did all of my brain health assessments and we did a neuroadrenal profile on me, I was
Mhm,
blown away by the impact because my serotonin. Hi, everybody, just so that you're aware, Jen's serotonin levels in my brain are actually pretty fucking stabilized. And
mhm,
I'm air quoting this right now, from
mhm.
being on an SSRI for 20 years, which we didn't know if that was because for some people it's not actually. It's
No, for some people,
tanked.
it's very
It's
low. For
ruined. Okay.
other people, it's
For
very
others, guess what?
high,
Mine
like
was right in
mhm,
the green zone. And so
mhm.
here I was as a budding new brain health, like want to learn about shit person. And I said to Terry, I go, I don't understand that. Explain to me why that looks great, but my dopamine, okay, and my norepinephrine is conversion to epinephrine is in the red. It's so bad. Like, I don't understand, right? So from an addiction perspective, guys, think about this of what Terry is going to share when it comes to, hi, I'm getting off of alcohol, I'm coming off, I'm getting put on a SSRI, okay, to help
Mhm.
with my symptoms, right? Okay. Now Terry, explain to me how that then harms the other major neurotransmitter pathways in the brain,
So
or can.
okay, so we have to understand the first thing that we have to understand is, um, medications or substances aren't very smart, right? Like, they're not just going to your brain, they're going to your entire body, okay? They're also disrupting things.
What you had just said is that neurotransmitters actually impact not just the brain, they are like your entire body, guys,
Mhm.
is filled
Is
with these.
impacted.
Like,
Yep,
they are impacted. So it's not just your head, it's not just your gut,
right.
it's the
But
entire body.
your gut health is going to be largely impacted by, alcohol, by other addictions, and
Yes.
by psychiatric medication. So, don't think that you're gonna get out scot-free because it's a psych med versus something alcohol, right?
Yep.
So, we in the addiction space, as we've talked about in part 1 and now in part 2, all we've talked about, and this is what I used to do too. Dopamine, dopamine, everything's dopamine. Dopamine, dopamine, dopamine. If you have an addiction, it's because your reward pathway is fucked up. Like, you have no
Yep.
dopamine, you don't have enough dopamine. It's all dopamine.
And if
And
you look it up, I got to insert this real quick. If you look it up, because I was trying to do a bunch of research for this episode, I
mhm,
was getting so pissed and I was messaging Terry about this because a lot of the research focuses and hinges so fucking heavily on dopamine. And of course,
right,
usually near the end of the research, like even when I'm going, like it always ends in like pharmaceutical interventions to try to tweak the
right,
dopamine because it's all about that reward pathway. I was happy to find some shit on serotonin, and then it still went into pharmaceutical interventions to manage serotonin
right.
instead of nutrition. So I was getting pissed,
Or
right? So I'm like, okay,
GABA
I'm done
too, like
researching. Okay, but I just
right.
want to say that. Okay, keep going on your Rob Peter to pay Paul thing, please. Okay.
Yes. So, I look at things like, and this is what my husband said. I say your body robs Peter to pay Paul when it's trying to get homeostasis. So
Yeah.
when you are flooding a receptor with, we'll say serotonin,
Serotonin.
right? So
Let's use
you
a
got an
let's use an
SSRI.
SSRI. That's what I'm on.
Yep,
Mhm.
you got the SSRI and you're flooding your receptor with serotonin and it's down regulating, right?
Yeah.
That's usually what happens. Your receptor will down regulate, and as you start tapering from that, it begins to up regulate again,
Yeah.
right? But that's during the time where it's not upregulating, that's when you're going to have those withdrawal symptoms. Now, also, in your body's attempt to find homeostasis, and this is going to be the low level scientific version, it will begin to deplete other neurotransmitters too. Okay. So
Like
you
my dopamine,
like
right?
your
Like
dopamine,
my dopamine.
exactly. Now, conversely, we can also think that I believe that a lot of depressive features are in the dopamine pathway rather than the serotonin, but it is always addressed first in the serotonin pathway when you're talking about pharmaceuticals, so SSRIs. And
SSRI.
then the SNRI came in, which is norepinephrine, which is in your dopamine pathway.
Yes.
But for the majority of people, when you present with depression, you're gonna get an SSRI. Must be serotonin.
Yes.
Must be serotonin,
Yeah.
you know? You never talk about, I think maybe this is dopamine," where I
Mm.
think so much of it is cortisol related and dopamine related, at that point,
Well,
it's
mine is.
gut
I
health
mean,
related,
when we're and yep.
related, gut health
Yep,
related.
and
Yeah.
I'm happy you can use these examples of me because this is literally what was
Mhm.
happening. The serotonin
Yeah.
looked great, but then once we stabilize that, then we're going to start to rob from the dopamine pathway, which is exactly what was happening with me. And it's kind of cool to have a neuroadrenal like testing done to see what that looks like because I actually have those results. But over time, I started to, rob Peter to pay Paul. So what was happening in my serotonin pathway was that down regulating happened so much, so much that my body started to steal from the dopamine pathway so that it could continue to function. And what we know about our dopamine pathway is dopamine converts to norepinephrine, which are you back here? I'm looking at the screen. Yes, you are, which then
I
converts
am.
to epinephrine. And that conversion was not happening. Partially because my body was trying to continue to reach homeostasis. And when my serotonin pathway is so down regulated and sleepy, it's starting to pull from the neurotransmitters from the dopamine pathway. So I very likely created a chemical issue in my dopamine pathway that I maybe didn't even have in the fucking first place.
Right.
But my norepinephrine was then not converting to epinephrine, which is our catecholamines for the fancy terms now that I can actually understand this now. And there's cortisol in there, which I wasn't making enough of to help do that in the first place. So I may have very well had a chemical imbalance created that was not even there in the first
Mhm.
place, which for me, we know it wasn't there. I mean, I had my heart broken. My boyfriend dumped me. It was in
It's like
situational issue. 20 years later,
mhm.
here I am on Lexapro. Okay. So here I tell Terry to start talking about rob Peter to pay Paul and what happens with the neurotransmitters in the body when you are taking psychiatric medications, which is very similar to what is happening, guys, when you are also
Your video is very
addicted to a
frozen to me,
substance,
so
and it's doing the same thing. Those substances are binding to these same receptor areas of the brain. So we are trying to bring this idea that when we are talking about addiction, okay, this idea is coming from this neurochemical standpoint. And I know that that really seems like a crazy ass idea, but we're going to go back to also this idea when we talk about alcohol. And I have a lot of patients right now that I'm working with that I do a lot of brain health work with. And they talk a lot about there's the struggle with alcohol. One of the first things that I talk about when I've got someone who's struggling with alcohol is this idea of, hey, guess what? Let's talk about your GABA receptor. Let's talk about what that is and what's happening. let's have a conversation about how years and years and years of alcohol has probably actually impacted some of your other neurotransmitters. And we bring in a discussion about serotonin. I don't even freaking start talking about dopamine when I don't even know if you do too when you have clients that are yeah, if we do a neuroadrenal profile and do some testing and look at it all, yeah, then we're going to
Mhm.
bring it in. But I don't even start with that shit. I'm just like, okay,
No.
let's talk about how alcohol impacts this exact same area of the brain, right? As say like a benzo does, right?
Mhm.
Let's talk about how that SSRI or that SNRI that you've been taking for 15 years in conjunction with the alcohol you drink every day has actually impacted your nutrition depletion, your very nutrition depletion, probably in several different areas. And guess what? Those two areas, those like that serotonin and that dopamine and even that GABA, those are all probably really trying to reach homeostasis and they don't know how to do it.
Well, and let's talk about how you're not eating nutritious foods
Yeah.
or protein, which are the building blocks of those
Yeah.
amino acids and
Let's hit our
neurotransmitters.
protein. Let's hit our
Yeah.
protein talk. Let's hit our fatty acid talk. And
Mhm.
let's also
B
hit like
vitamins,
even
vitamin
B,
D,
B,
vitamin
D,
B, C,
and
all of these
magnesium. Like,
and
let's just
magnesium.
hit them. These are our big, like,
Mhm.
we Terry and I were trying to come up with, like, we want to put something together that is like our power pack, right? For like, here are the top 5 things that for the most part, right? And we're going to, always consult with your physician, blah, 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 do all the things, right? And I say blah, 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 because like, we probably know a little bit more than many of them do
Mhm.
about like nutrition deficiency.
Mhm.
Anyways, but the top like pack, the 5, the big 5, the big 6, the
Mhm.
whatever, right? And this is very similar even for like if I had a patient who's struggling only with mental health pieces versus somebody who has struggling with addiction or a dual thing,
Same.
right? Because
It's the
man,
same.
I'd be hard pressed to have a patient that just struggled with only heroin use and didn't have a whole bunch of other mental health pieces to this too. So
Exactly, and so that always makes me wonder, Jen, when we're talking about this, like, the dual diagnosis, right? So, I've always thought about the dual diagnosis as being what came first, the chicken.
the chicken or the egg, and then you pause when you're saying like totally fantastic things, right? You've always thought about what comes first. I don't know, does it even matter? Like if the chicken came first or the egg came first, right? Like does it even really
Or
like
the mental health thing.
yeah. You were trying to say that it's simultaneous. I don't disagree with that either. The dual diagnosis piece, like separating it out and saying that there's a mental health issue and then there's also a substance issue, right? Like I think that makes sense for people in terms of like old thinking, and I'm going to say old thinking or traditional thinking with treatment interventions. But I think I think it's actually what it's missing is the idea that they may very well and are in a relationship, and these things are working in tandem together. And so I don't necessarily know, like this kind of goes back to the timeline stuff. I don't necessarily know if we can actually say I don't think we could say this came first, this came second. The chicken or the egg idea, right? Like I think it's all one. And when you and I are
Mhm.
talking about looking at a neurochemical basis of treatment and looking at bringing in these interventions, it really expunges the dual diagnosis word anyways because guess what? The treatment intervention is going to be similar.
Mhm.
We are going to give you a similar intervention. If you're going to come to me and you just have major depression, you're going to come to me and say, Jen, I'm addicted to alcohol. I'm going to actually give some very similar interventions treatment wise from a brain health standpoint. So what came first or last? I guess it matters, but it really doesn't. Um, and so we're going to take that holistic standpoint and look at it from that way. We're going to go back in your timeline and really look at, what came first for you. But again, I didn't have many clients in the inpatient facility, which I think is also kind of interesting too. I had clients that I worked with. Some were technically in an inpatient facility for years. I mean, they were incarcerated and they did dual diagnosis programs that were 6 to 9 months long. They did like residential type programs that weren't quite as long, like 30 days, 60 days, 90 days. And that was kind of based off of how much treatment you needed. And that was dosed out by, depending upon the criteria that you met, we're only going to give you this many hours of treatment, because research has shown that if we give you too much treatment, we aren't doing you a service, or we are making things worse. And so for some patients I had, it was a very quick treatment intervention where it was only, 30 days or 60 days. For others, I had patients that were in treatment in corrections for years. This would be considered years in a program, and people were not getting better.
It
Sober,
definitely
you were
mhm,
sober. You
mhm.
were sober and you completed a program, but that to me is not a marker of success, especially when you're in an environment where we have completely restricted everything from you. Now, can you still get stuff in there? 100%. However, it really isn't a testament to success, at least in my mind, because we never addressed like all of the brain stuff. So, that being said, I think that that's a big piece to this. And I'm doing a lot of talking for our audience right now because poor Terry keeps freezing. And so I'm kind of jumping all over the place and trying to talk about this idea of food and mood and using nutrition, supplementations, fatty acids, complex carbs to, help balance that brain.
Mhm.
Um, and so I'm doing a lot of like jumping around here. And Terry, if you come back in here, let me know, because you are kind of frozen. So it's hard to know where you're at. But for somebody who is in recovery, um, I said this a little bit earlier, and I think it's important for us to understand the idea of a recovery diet or a recovery based off of brain health. And I don't know if you have any thoughts on that, Terry. And I'm actually going to say, I know you probably do, but it's so hard for you to talk because you
Like,
keep,
every time I
yeah,
talk, I
every
get
time you talk,
disconnected.
you're gone. But I want to remove this whole idea of nutrition for recovery, and I want to say nutrition even if you are struggling with addiction or struggling with substance use, or you are struggling with being addicted to a pharmaceutical intervention, because that is has impacted your brain. Um, the answer that Terry and I are going to give is going to be very similar across those platforms. And here she is. If you're on YouTube right now, you can see her trying so
Oh!
hard. And every time she talks, right, like she loses it. And she starts, it says a word, she's frozen. I hope that you can hear me. Yeah, I got you. I can hear you in my ears. Okay. Okay. All right. So I'm very sorry about the technical crap, everybody. Um, Years ago, before COVID happened, I had a dream about going to every recovery center that I could possibly go to in the United States and give them a program. And the program would be nutrition based and brain health based. And I had a little bit of pushback as far as like, well, nobody's going to pay for that kind of stuff. And supplements are expensive. How do people keep doing that after they leave the recovery center? But I still think it's a viable option. And I would like to bring that forward, at least in the idea of some educational programming for recovery centers that are out there. Now, I say recovery centers because a lot of them are privately owned versus,
Yeah.
a hospital center, things like that would definitely not let me in to help them out. So if you are out there and you know a recovery center that could benefit from some brain health training and have Jen and I come out and actually give you the whole spiel, we are 100% open to that opportunity.
Yeah.
Wouldn't that be great? That the brain health stuff is so missing, not just in the addiction community, but in mental health. It's basically missing in the American world.
Yeah.
Because our rates of addiction are going through the roof. And the rates of recovery are terrible. And the rates of mental health problems are also increasing at the same time. Yeah. We need to do something, and I feel like brain health is the way. And it's not just about dopamine. It was never just about dopamine. I think dopamine is just easy to talk about. Yeah,
You
no,
know,
it is, and I'm like, I don't know if you could see, but look at this nice little pop socket I got. Look at this Gaslit Truth
oh yeah,
merch right
gaslit
here.
truth.
Hey, check it out. Okay,
You know
anyways,
what's really weird, Jen? This whole time I've been talking to you, I've
yeah.
been online at the same time, even though I'm through your phone. What the fuck is that?
Yeah, I don't know. It is very weird, and actually, now that you just said that, you totally froze.
That's fun.
Yeah, like even your phone is cutting out. Yeah, which is like super crappy here. I don't even know how this is happening. Like, what is happening in the universe to us today? Like, for
I
some
don't know.
reason, we have this bad juju that doesn't want us to talk about brain health
Brain health.
when it comes to treating addiction. Addiction to legal substances, addiction to illegal substances. Hi, my name is Jen. I'm addicted to fucking Lexapro. I mean, all the criteria for substance use disorder, all of them.
She's got.
Damn.
And I
And
had when I was on sertraline.
yeah, yeah, and
Same thing.
that's so that is like, and if I think it's a good space probably here on to get closer to wrapping up, just because when we're having all these technical issues, right? And we will.
So sorry.
That's all right. Hey, listen, we are making shit work. Do you see this IT stuff happening right now? Like, I don't think we should do a call to action to go to a treatment, like addiction treatment center somewhere. Our call to action needs to be, hey, do you need IT? Do you need really smart
Yeah,
IT
right.
people? Give us a holler. We'll come and help you out. Because it's going to be us putting a phone up to a microphone. And
Right.
this is what's going to happen, right?
This happens on telehealth sometimes too.
It does. I know this. I was just going to say, I've done this with my patients on telehealth. I'm like, hang on, I'm just going to call you, but we'll keep the camera up and vice versa.
Yep.
But
Same thing.
I think that this idea started for us to bring this up for the podcast just because of the resistance and the struggle that happens in the addiction space when it comes to outside of the box thinking of how to treat addiction. You were just saying before, like, what comes first, the chicken or the egg, right? Like, what comes first? Is it addiction? Do we have mental health issues, right? And right when you pause there, right, I was kind of like, who the fuck cares? It's the treatment
Right.
interventions are all the same. Yes, we're going to go back and do a timeline. Yes, we're going to find those pain points because those fucking matter. Like, even in the case of your husband, right? Yes, these pain points matter. But at the same time, these interventions we're talking about are not as like crazy ass different as you would think that they are. From a neurochemical standpoint, we're gonna help treat that first, which, by the way, guys, takes a while.
It does.
It
It's not a
it
fast thing.
I mean, it's not a fast thing. So the thought that an addiction center that you're inpatient for 30 days or even 60 days, right? Like, this is what I was saying. I had patients that I worked with for years, 2 or 3 years, which always got me curious about the fact that, like, what I'm doing in treatment is probably not working. That's crazy to me, right? Like, but
I want to add this in though, Jen. If you do start working on your neurochemistry and you are in addiction or even in mental health,
yeah,
it's not a fast track, but I will tell you that it will be faster. Your suffering won't last as long if you do focus in on the health of your brain.
yeah,
versus somebody who is just white knuckling through their first year.
yes.
You know, if you can put some of these nutrient options in place,
yes,
I do believe that we're going to end suffering the way we see it today and hopefully reduce the amount of relapse that we have as well.
yeah. Is that is the overall goal, right? Like, that is the whole goal, whether you're trying to withdraw off of a psychiatric medication and titrate and get through that in an effective way, or you're coming off of an opiate of some sorts, right? And you're trying to get through that process. Regardless, right? The goal is to try to do it in a way that is the safest for your brain. I have people ask me this all the time. They're like, why would you go through this? Like, you could just stop taking it. And I said, could I do that 100%? And all these stories of people that reach out to us, right, that are doing this, 100%. Yes, you can do that. But I am not willing to risk another physical ailment that's going to happen to me. I'm not willing to risk my heart. I'm not willing to risk my physical health. I'm not willing to risk any more fucking brain zaps and what's happening actually in my brain, I'm not going to risk any more little mini seizure-like activities that could happen, or tardive dystonia that doesn't go away, and tics that I have developed now that won't ever stop because I'm trying to get off of something. And so it's this idea, right, that like there are huge risks to doing things from a brain health perspective in that white knuckle fashion, right? Which is done in the psychiatric community. It's done in the like illegal drug community, addiction community. And I'm piecing these separately, but you guys were talking about the same thing.
But this always makes me wonder one thing. So the psychiatric medication withdrawal community is the only community that they tell you to taper slowly. Everything else is we're going to do it. We're going to do it now. We're going to wash this stuff out of you immediately and kind of let the chips fall where they may. Even though people are experiencing a lot of withdrawal symptoms when they do that, and potential with alcohol, deadly symptoms, or even with benzodiazepines.
Yeah. So I was just, and you got to ask two things, right? The other thing is not only is it the only community that does that, but it's one of the very few communities that says, you know what? If you start to withdraw, go put more in your body.
Exactly.
Go put more in your body. I wouldn't, and that's just it.
You would never say that to somebody who is withdrawing from alcohol or other drugs.
Yeah, you're coming off of a really bad withdrawal from heroin, right? Or from some type of some amphetamines, right?
I think you need more
narcotics. Hey, guess what?
Or wait a minute, you're in withdrawal from this and you're experiencing anxiety and you can't sleep. Maybe you need to go back on it. You would never say that to somebody who is using any other substance besides psych meds.
Yeah, so these are those words, right?
Even though the same rules apply, if you just take the word out, the medication out, it's the exact same thing.
Yes.
But it also makes me wonder then, okay, because of that, and I know the real answer to this, but I'm going to bring up a conspiracy theory answer.
All right, you do it.
Makes me wonder if psychiatric medications are even worse for you than we originally believed. So if people can't get through withdrawal at all, but yet you can get through withdrawal with heroin or meth or any other drugs or even alcohol, you can get through it. But people cannot get off these medications. That's worse? Curious to me.
Yeah. How detrimental are they?
Mm-hmm. Exactly.
How impactful are they on all the neurotransmitters, on 100%. All of the body, on all of the brain
systems,
all the body systems? Mm-hmm. Yes. Yep. It does. So, get curious about it. That is what we're talking about today. So brain health.
Well, I'm going to let Jen end this because this has not been great for me.
I know.
So I'm so sorry, everybody, for these technical problems, but thanks for hanging out with us anyway while I'm on the phone.
Hey, you know what? And every time you pause, I just kept talking, and there's definitely some circle talking, right? Because there's a couple times where I'm like, I'm not really quite sure where she's going to go with this, but I'll just go where I thought I would go with it, right? And we are doing our very best here to make all these things happen. So we are the Gaslit Truth Podcast. This was part 2 of a 2-part episode. So again, if you caught this one, didn't listen to the other one, go back, because you've almost got to listen to both of them in tandem, in order, right? But if you don't, who the fuck cares? You'll figure it out. You're smart people. And here's the deal. We want to, one, say thank you to all of our listeners. 2, say thank you to those of you that listen to both of these episodes, because this is a hot topic. It's something that people get very, 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 they get real hot about it, and they get heated about it. And most of the time people get heated, one, because you're in it, you're experiencing it, you've been harmed by it, and maybe you just don't see it yet until we can kind of lay things out. So if you stayed through it with us, thank you. You can find us, the Gaslit Truth Podcast, anywhere that you listen to your podcasts. And you can also find us on all the socials. We've got a YouTube page. We've got an Insta page. We're on Facebook. Terry and I are also both on, we've got TikTok accounts and Instagram accounts as well. So if you ever see us on there, we are going to post the video on our YouTube page of the video that I did on TikTok that actually inspired us to do these 2 episodes, because of the responses that I had received. But make sure you reach out to us if you like to just DM us. Please do, or you can send us an email at thegaslittruthpodcast@gmail.com. And we're here to tell you guys to just stay freaking curious, damn it.
Thanks for listening.
Thanks, guys.